Hi, I'm Liz Margolies. I'm the founder and executive director of the National LGBT Cancer Network. Increased cancer risks in the LGBT population are caused by behaviors, many of which can be traced to the stress or stigma of living as sexual or gender minorities in this country. For example, LGBT people use tobacco at nearly twice the national average. LGBT people also use and abuse alcohol at much higher rates. And what you see in the general population, which is that alcohol use tends to decrease with age, that's less true among LGBT people. What we see for lesbians is also a greater tendency to have a high-fat diet or be overweight. They are less likely to have a child before age 30, which would have some protective factors. And for gay men, what we also see is a much higher rate of HPV that can lead to anal cancer. What we're also seeing is that people living with HIV and AIDS, which is many people in the LGBT community, as they're aging, they are getting cancer at a much higher rate than the general population, at a younger age than we see these cancers in the general population, and the treatment is then complicated because of the medications they take. I'm not talking about the AIDS-defining cancers that most of us know about, but other cancers like lung cancer and anal cancer that we're seeing in the aging HIV population. A second barrier to care is fear, discrimination, or previous negative experiences in the healthcare system. There was a new research that just came out this week that showed that even today, the amount of LGBT time spent in an entire medical school education is 5 hours. That is not enough to talk about our unique health needs and risks and family structures, etc. There are lots of things that need to change so that LGBT people will feel comfortable engaging with the healthcare system. And one of the most basic things, and this is outside our scope here, is that we need to make discrimination against LGBT people illegal. We need to, because every LGBT person carries that threat around every day and wonders whether we are safe. The problem with us not feeling safe when we engage with the healthcare system is that we can't be open about our lives and therefore our health risks. So the legally married man who may actually not be living with his wife but have a primary relationship with another man, or just be having casual sexual encounters with other men, if he doesn't feel safe talking to his doctor about the kind of sex he's engaging in, his doctor doesn't even know to suggest that he be tested for anal cancer, for example, and give him an anal pap. If we can't say what's really going on, I think it affects treatment. It means we're less likely to get screening. We need to make it safe for us to be in the healthcare system. My organization was recently selected by the Health and Hospitals Corporation of New York City, which is the largest municipal hospital system in the country, to create an LGBT cultural competence training program that is now mandatory for all 38,000 employees. And what makes HHC so special is that the mandate came from the top, and it will go to everybody. It's not one gay man who runs some department who makes sure that everybody in his department knows how to speak respectfully to LGBT people, knows how to make them feel safe, knows how to create a welcoming environment, but everybody, every single person in every single facility will be trained. And I like to think that today it's HHC, and tomorrow it's all of New York State, and next week it's the entire country.